Hi, it's Inam and Nima, and we have chosen to talk about Alzheimer's disease. Brain is a complex organ composed of different hemispheres controlling motor function, memory retainment, emotional, auditory, and visual processing, among other functions. Dementia is not a disease, but a set of symptoms like poor memory function, difficulty learning, and other cognitive effects, causing poor functional independency of individuals throughout their daily life. Alzheimer's disease is the most common cause of symptoms of dementia that leads to characteristic brain tissue damage. Neurodegenerative in nature, it leads to neuron loss within the brain, especially of the cortex.
60 to 70% of all dementia cases are caused by Alzheimer's disease. Globally, it affects around 29 million people, especially in North America and Australia, common amongst people over the age of 65, reflected by more than 50% of cases from people over 85 years of age.
Though not completely understood, Alzheimer's disease represents two common players involved in progression: beta amyloid plaques and neurofibrillary tangles. As plaques and tangles build up and damage accumulates in neurons, the disease progresses from acute to chronic stages. In early stages, patients are asymptomatic. Short-term memory loss leads to a person forgetting daily tasks they completed. Over time, speech becomes more difficult, making it difficult to communicate, caused by motor functionality loss. Disorientation, impaired motor function, and mood swings are observed as the neurons become more severely impaired, leading to a patient losing long-term memory.
Neuronal cell membranes contain amyloid precursor protein, which is thought to help growth and repair post-injury. Recycling of the protein is carried out by alpha secretase and gamma secretase, each cleaving the membrane-spanning protein to soluble products, unproblematic in nature. Beta secretase cleaves the amyloid precursor protein on the outside, creating an insoluble monomer called amyloid beta, which is not soluble and aggregate just outside the neurons, forming plaques. This leads to disruption of signal transduction between presynaptic and postsynaptic neurons, as neurotransmitters cannot cross the membranes. This results in impaired coordination. Plaques also lead to immune cell accumulation and inflammation, damaging surrounding neurons.
Microtubules are cellular cytoskeletons that allow cellular transport of cargo as well as cell division. Tau proteins stabilize microtubules, which are dynamic in nature, going through rapid polymerization and depolymerization. When tau proteins are phosphorylated by protein kinases, they form the neurofibrillary tangles. It is thought that the beta amyloid plaques on the outside initiate cellular upregulation of kinases involved in tau protein phosphorylation, dissociating them from microtubules. This leads to their aggregation within the cytoplasm, forming tangles. Microtubules are left destabilized and they undergo rapid depolymerization, which leads to disruption of cell signaling, intracellular transport, and leads to programmed cell death or apoptosis.
The result is a broad-scale cerebral atrophy or shrinkage, resulting in gyri becoming narrower and sulci becoming wider as neurons die off.
There are two types of Alzheimer's disease, late and early onset. Late onset is constituent of more than 90% of cases, while 5 to 10% is a form of early onset or the familial type of disease. The exact cause of long-term onset is not known, though it is hypothesized that the risk factors of this type is a combination of genetic and environmental risk factors, both of which increases as one ages. This is reflected by 1% of people 60 to 65 years old of age developing the disease, while more than 50% of over the age of 80 years old develop the disease. In familial forms, genetic reasons are exaggerated. Peresinilin 1 and 2 genes are in chromosome 1 and 14 as an example, both creating subunits of gamma secretase. Mutations in these lead to the preferential cut at the locations of APP that cause beta amyloid aggregation in nature. In Down syndrome or trisomy 21, chromosome 21 is present in 3 copies, which coincidentally contains the amyloid precursor protein, and hence leads to greater expression and early onset. Folate is a form of vitamin B involved in nucleic acid and S-adenosylmethionine SAM synthesis. Crucial to one-carbon metabolism, SAM can lead to epigenetic changes that is differentially regulated by tissue types. A study done by Chen et al. In 2016 showed that increase in serum concentration of folate caused a decrease in amyloid beta 42/40 ratio, inflammatory tumor necrosis factor alpha at transcriptional and translational level, as well as elevated levels of SAM. Aged brain samples show elevation of the same inflammatory factors, as well as cyclic AMP-activated protein kinase and Alzheimer's disease symptomatic phosphodiesterase, which are reduced in SAM elevations. SAM's role in epigenetic modifications, repression of pro-inflammatory cytokine expression, and upregulation of anti-inflammatory cytokine like interleukin-10 makes folate supplementation with Alzheimer's drug attractive, where pro-inflammatory markers are increased. Drug delivery across the blood-brain barrier is a major roadblock to the treatment of Alzheimer's disease. Pioglitazone is a drug commonly used for treatment of diabetes, which has been also shown to be anti-inflammatory, anti-fibrotic, anti-cancerous. One solution for blood-brain barrier crossing and effective delivery of drug is the use of nanoparticle-coated drugs, which can help target drugs to specific tissue, show better kinetics, and improve absorption. In a study done by Silva et al. 2018, polylactic co-glycolic acid polymer was conjugated with polyethylene glycol for PGZ delivery to brain tissue in vitro, which resulted in 50 times greater uptake, delayed release of the drug, which potentially contributed to better uptake as drugs could cross the blood-brain barrier before release. In addition, the drugs did not show profiles of aggregation, and in APPPS1 Alzheimer's mice model showed reduction in memory impairment and amyloid beta deposition. Therefore, future treatments of Alzheimer's disease should focus on the use of new drug development as well as specific tissue targeting delivery methods, utilizing nanoparticles which are biocompatible.